right, it's 12:30, so we're going to jump right in here. I'm Joshua Matheny here from Smart Training, and again, welcome to all those that have joined with us. We're excited to have you and talk about this important topic. So I have the opportunity to introduce David Wornica, who's relatively new with us here at Smart Training. He is the Director of Healthcare Compliance at Smart Training and a current registered dental assistant in the state of Texas since 2010. He's conducted hundreds of compliance inspections with dental practices and worked with practice owners to remediate issues discovered during that inspection process. He has found a particular passion in helping new dentists and startup practices start off on the right foot. Prior to joining Smart Training as a dental assistant, he was an OSHA lead and infection control coordinator for a client practice in Austin for close to 10 years. In his free time, he enjoys gardening with his wife, reading, volunteering in his community, and satisfying his OCD. And to satisfy his OCD, assembling oversized jigsaw puzzles. Think 18,000 plus pieces. So he can definitely see the big picture and put it all together for you. I'm sure he'd like to apologize in advance for his allergies, and hopefully his voice doesn't give out halfway through the webinar. But with that, David, I turn the time over to you.
Thank you so much for the kind introduction. I really appreciate it. And I do want to apologize in advance to everybody if for some reason I start to lose my voice and pop in a throat lozenge. Again, thank you for your time, though. It's really appreciated. I look forward to presenting this information to y'all today. I did want to mention before we dive into my contact info will be at the end of the presentation. A lot of times these kind of discussions tend to elicit a lot of questions. While it's encouraged to put questions into the chat, sometimes you may have something that's just a little bit more involved than time might allow. So please feel free to email me, call me. I'm always available to chat, and I really look forward to chatting with you. Additionally, to preface this conversation, this presentation is not meant to be scary. Okay, my goal here is not to frighten anybody. I just want to share some good information that can hopefully keep you from experiencing some pitfalls that do occur when situations go awry. So anyhow, let me go ahead and jump into the slide portion of the presentation. I'm going to remove my picture here. All right. So I want to talk to you a little bit today about what the most common violations are in OSHA and how to avoid them. As you may have already guessed, the most common OSHA citation tends to be OSHA's bloodborne pathogen standard, or good old 1910-1030. Now, this here on the screen is awfully text heavy, but it is the actual verbiage from OSHA as to what the bloodborne pathogen standard pertains to. I do want you to bear in mind, in addition to this, there are roughly 200 subchapters to this standard. What does that mean? Well, if you haven't guessed already, it means there are many potential pitfalls, places where we can go awry or when things can get kind of out of control. Now, I want to jump over here and just kind of talk a little bit about what is in the bloodborne pathogen standard. As many of you already know, or may already know, this came into being in 1991. And originally, the standard was as a response to global concerns related to bloodborne diseases like HIV, hepatitis, syphilis, malaria, just to name a couple. The goal of the standard is to reduce transmission, obviously, of these diseases and others by creating safer environments that we all work in. And some of the items that the standard requires are going to be listed below here. Establishing and annually updating an exposure control plan. As you may know, that's part of your OSHA binder. Let me see, provide initial and annual education and training to workers. We know that we do our annual OSHA training and we make sure that everyone gets that. One of the pitfalls that grabs people sometimes is they may have training and then bring on a new team member sometime after that, and that person ends up having to wait on training. But you really shouldn't be waiting on that. And we'll get into that in more detail in a bit. Also, making available hepatitis B vaccination series to your team members or your employees. You want to do that straight away. And again, these topics that are on here, we'll get into more detail in a bit. I just want to briefly outline this. and implementation use of universal precautions, identifying and using engineering and work practice controls. And again, we'll get into this in more detail. And the use of warning labels, signs to communicate hazards to team members. And if you walk into just about any sterilization area, and I always pick on sterilization, you're going to see all the biohazard signs on just about everything. I always like to tell folks, my clients especially, OSHA views safety kind of through the lens of it's your team member, your employee's first day on the job. They have zero experience in the field, and they're trying as hard as they can to either injure themselves or do something just that we'd call silly. Okay, so that's kind of why we have all these insanely detailed items here that we have to make sure that are in place. It's just all about safety for everybody. And then the standard also recommends or says we must establish post-exposure evaluation and follow-up plans. So all your paperwork, and maintain these records and the training records as well. We may need to provide that if ever there's a violation or an inspection or something to that effect. Additionally, in 2000, about 10 years later, there was the Needle Stick Safety and Prevention Act that came into being. And this was from the realization that so many exposure incidents were due to needle sticks or pokes, slices, that kind of thing. And what they introduced with this goes a step further to prevention. Exposure control plan, again, making it, this is mandatory. It's not an option. It has to be done. A job hazard analysis or an assessment so we know what the exposure risk is to team members and we're able to train and plan accordingly. Also, a review of those work and engineering practice controls. And like I said earlier, we're going to get into this a little deeper in a moment. Training. Hep B vaccinations for anybody, anyone on the team that's exposed at the employer's expense. I don't know how many times I get folks asking me whether or not this is something that, oh, do I reimburse that? Do I have to send them somewhere? What if they don't want it? You got to offer it, and you've got to have documentation. Documentation is key. If you don't pick up anything else from this, please know it's all about documentation. If you don't document it, it didn't happen in the eyes of OSHA. So please just keep that in mind. All right. I did want to spend a little extra time here in the beginning talking about universal precautions. Again, this is kind of a thing that gets people from time to time. And the main thing here, the prevention is the crux of the bloodborne pathogen standard. And it really focuses so much on being sure that you've taken the correct precautions. And now universal precautions assume that all body fluids, blood, saliva secretions, sites, open wounds, mucous membranes, they could contain pathogenic microorganisms. Okay. And we're asking that everyone observe universal precautions because it treats everything that way. And these precautions are hand hygiene, the use of personal protective equipment, engineering work practice controls, different things that limit exposure. I know this may seem like a 101 kind of course, but you'd be shocked how many people just aren't aware of this or don't even take this into consideration. Engineering controls, tools designed to isolate and remove contaminated equipment from the workplace. Work practice controls, those are alterations to a workplace task to reduce the likelihood of exposure. When combined, these controls can effectively eliminate or reduce the risk of exposure and transmission of infectious disease. That's why we harp on this so much. Examples of some of these are, again, your hand washing facilities, antiseptic hand cleanser, proper PPE usage, needle safety devices, sharps containers, proper handling, storage, disposal of infectious or hazardous materials. It's just very important to have these systems in place and be aware of their existence. I'm shocked sometimes during inspections how many folks just aren't even aware that they need to look into these things. So now that I share all that with you, I share that so that I can share this. What exactly does a violation look like? How does it happen? I know we've all heard stories about someone who knew someone who had an inspector make a surprise visit at the office. Maybe they walked in, slapped a card on the desk, said, "Hey, I'm Joe Bob and I'm here from OSHA and we're going to do an inspection today." While that does happen from time to time, more often than not, these types of issues arise from an anonymous complaint. More often than not, it looks like a piece of mail comes in from the Department of Labor, OSHA, and the front office team maybe puts that on Doc's desk or the practice owner's desk. Okay. 9 times out of 10, it's a complaint. It's been filed anonymously, like I'd mentioned. And it could be an upset employee who maybe had something happen, or maybe they're just, maybe bitter. Could be an ex-spouse, significant other. Even a patient who might have spotted something they didn't particularly like during a visit. I've heard of things such as someone walked by a room and saw instruments open already when they walked in. I mean, these kind of things happen. So if we're able to put good systems in place, maybe we can spare ourselves those issues. So part of what I wanted to do today is I went to the OSHA.gov website and I grabbed a couple of violations off of there to share with you. I'm going to review those in just a second. I did want to let you know too, all these items are public record. I've gone ahead and had the information, the identifying information blocked out though, because I don't want to call anyone out. But I want to let you know this stuff is available on the website, so you're more than welcome to check it out. It's very interesting information to really kind of sift through and see if you have any blind spots, see if you can identify them. So without further ado, this first slide is an office that was in it is still in Pennsylvania. They received this in January, okay, of this year. Now, while I'm not 100% sure how this situation, went down, with a little bit of sense and clinical experience, I think we can interpret how these citations occurred in the practice. So I want to draw your attention to a couple items here. I know this might be a little small, and I apologize for that, but you'll see where I've highlighted it. This opened in January, and on the lower left, you can see the inspection type was a complaint, and there was no advance notice. Leads me to believe it was an anonymous complaint. I'd wager from what I'm probably going to show you in a second here, I say probably, what I'm going to show you in a second here, is that maybe it was a team member who experienced the needle stick. It might not have been happy with how the event occurred. Not that anyone's ever happy with it, but maybe paperwork wasn't handled right. Maybe Doc was an old baseball coach and said, rub some dirt on it. I don't know. But let's kind of dive in a little deeper here and take a peek. So this is what you see when you go to OSHA.gov and you start looking up complaints in the dental or healthcare industry. This is related activity to the complaint. Now, I've gone ahead and circled a really scary number in the middle, and I don't want to draw your attention to that quite yet. But what I would like you to see is that list on the bottom with highlighted items. In the second column that's over to the right, it talks about citation types. I want you to see that it says serious for 3 of these citations, and then 2 that are classified as other. Okay. And then next to that, you'll see the standard that's cited. We're going to dive a little deeper into this, and I'm going to pull up the actual information from the OSHA subchapters and the bloodborne pathogen standard we talked about earlier, and just kind of relay to you what happened in this instance and kind of dissect it a bit so we can, learn more. All right. I do find it kind of interesting too that this happened in January, and here we are when I pulled this file about 3.5 months later here, and it just wasn't solved. Anyhow, let me jump over to the next slide here, and we'll kind of see if we can't figure out what happened. I'd like to go violation by violation with you here. And again, there's going to be a lot of small print on this next slide, so feel free just to kind of sit back and listen to my soothing voice, just sort of read it over to you. Let's just kind of hop in here. All right, so we're going to start on the left-hand side and work our way down if you are intent on reading it. So this is, let's start up here at CO12C. This was a $4,000 assessment here. And it says, the procedure for the valuation of circumstances surrounding exposure incidents as required by paragraph F31 of this standard, which is the documentation of the routes of exposure and the circumstances under which the exposure occurred. Reading between the lines there, it seems to me like maybe the Sharps injury log and appropriate paperwork probably wasn't completed, might not have even been available. So obviously that's a concern to the tune of about $4,000. And that's not a terribly difficult thing to do if you'd been, aware of what needed to be done or what needed to be in place. you're going to find that with so much of this stuff, folks just don't know what they don't know. You go to dental school, they teach you how to do wonderful dentistry, and no one shows you what you need for all this kind of stuff. You're sort of left out there in the wilderness. But anyhow, let's jump over to the next one here. And DO2. This was a zero fine, zero numerical value, and this was about engineering and work practice controls. Now we know work practice controls, like we talked about, are used to designate the safest methods for performing a task. An employer should continually monitor, and continually is the important word here, monitor and review worker behavior as well as the work environment to guard against unsafe work practices. Now, when I say continually, that means when new products hit the market or there's something that can help your team work safer or more safely, I should say, you need to investigate those. You need to try and get a sample, learn more. If we can find a way to make things safer, there's really no excuse not to. If it's a phone call or an email, we should make that phone call, send that email. So here it was a zero. I'm kind of assuming maybe they had a work practice control available, and maybe the team member was oblivious to it or just wasn't sure. Could have been a lack of training. We'll get into that in a second too. But that's kind of how I'm interpreting that. Maybe that's why it was a zero fine. I'm not sure. The next item for 376, collection and testing of blood for HBV and HIV serological status. Exposure control program, your OSHA binder, should outline the appropriate steps and resources necessary to navigate an injury. What I mean by that is you should have a list of what steps need to be taken and what we need to do to make sure that folks, are being taken care of if they do poke themselves. You can find lots of resources online for that as well. Oftentimes, this solicits quite a few questions. So I would say if you have questions about that particular necessity or exactly what that looks like, please, at the end of the presentation, feel free to zip me an email. I'm happy to get back with you and talk to you in more detail about that. I just don't want to burden the record too much with that today, right now. All right, next section here, CO14. Now, I told y'all we'd be spending some time on this slide. I hope your eyes aren't straining too much and maybe you're just listening instead. The procedure for the evaluation of circumstance, I already read that. The exposure control plan shall be reviewed and updated at least annually and whenever necessary to reflect new or modified tasks and procedures which affect occupational exposure and to reflect new or revised employee positions with occupational exposure. The review and update of such plans shall also be documented. Now, this tells me maybe the OSHA binder doesn't have exactly in there what it should. Might even be out of date, and that would be considered over 12 months as it is an annual requirement. And I'm thinking this is lumped into the job hazard assessment as well that should be being performed every year. Because if that's not updated and maybe someone's assumed a new job role in the practice or maybe an existing job role now has different risk factors involved, that could play into this. So that's to the tune of another $4,000. You can see now it's really stacking up. Our last one here, GO24. This is by far, if you go to OSHA.gov and you look at healthcare, dental offices in particular, you're going to find this standard quoted just about everywhere, this subchapter of the standard. And it has to do with annual training for all employees shall be provided with 1 year of their previous training. We know training for OSHA, annual requirement. And one of the pitfalls it tends to get people is a new team member starts and they haven't got their training because we do it as an office and we did it in January. Here we are in May, someone gets hurt, something happens, there's an inspection, training's not completed. It's supposed to be all team members. What's the deal? So again, it's not optional, has to be completed without exception. And it's also got to be documented. If there's one thing that I hope y'all take away today, and maybe you hear it in your ears after this, is my voice saying documentation, documentation, documentation. Please keep that in mind. Anyway, as you can see here, this one incident that this practice succumbed to really had a cascading effect. Once an inspector kind of gets involved and they start looking, it's really amazing what they can find and how it can begin to add up and just pile on, because so many of these subchapters are just, I'm going to use the word complementary of each other, and it just builds. So this, in my impression, was maybe someone who got poked, again, didn't like how it was handled, and then on investigation, they had every right not to like how it was handled. Maybe they weren't trained. Maybe they weren't offered the Hep B vaccine. Maybe they weren't aware of the work practice controls in the practice, and there was no paperwork to be consulted on. There's just so many different things that can lead into this. I have heard some folks say that it really depends on the inspector who's looking at the violations or developing them, looking at the case, I'm going to call it. And they're saying, well, maybe they're just having a bad day, so they're just piling on, But I'd say as an employer or practice owner, if you're taking the appropriate steps, keep this from happening, you're not going to be in a position to be at the mercy of an inspector's good or bad day. So I can't stress that enough. All right. Another popular question, another thing that comes up is folks say, man, I'm way out here, David. I'm out in the middle of West Texas. There's nobody around here. Nobody's going to come all this way to inspect my practice. I'm not going to have any issues. Well, that's kind of closed thinking. Um, any you got employees, you're responsible. I mean, that's just the way it goes. And if you can receive mail, you can certainly receive an OSHA complaint. And as surely as someone can get gas in their tank, they can show up at your office and say, hey, I want to take a look around. So this next one I show you is from the state of Hawaii. Maybe that doesn't so much apply to the gas tank thing, but it does apply to the mail. Anyhow, what I wanted to share is just kind of a sneak peek at what happened in this particular practice. It's in similar vein to the last one. Again, the print's a little small here, but I've blown it up in the slide, so hopefully you can see it okay. This case is closed, which is a wonderful thing that they're not still fussing with it. It opened in early December and kind of went through the holiday season. So I can imagine what, doc, practice owner was kind of dealing with this thing through the holidays. It got resolved in towards the end of February. I just thought it was kind of interesting because it was sort of off the beaten path. And it says here the inspection type was planned. Now, I did a little research on that to see what some variables might look like there as far as things being planned. Could mean maybe they had contact with the with OSHA or Department of Labor prior. Maybe this might be follow up to an issue they had in the past. Could be maybe there was some conversation. It's just a lot of variables at play here. But either way, they were contacted in advance. An inspection was planned, and they just kind of went from there. Sometimes you could have, oh, I misspoke there, and I apologize. It says advance notice, no. So they obviously weren't contacted to have someone come out there. So it kind of beguiles me. I got to look more into that and see exactly what that means. But anyhow, case was from December, resolved in February. Sometimes folks do have organizations that work with them on OSHA complaints, so I can't help but wonder if maybe that was how it became planned. Just a thought. Maybe they arranged to come back at a later date or something. All right, let's jump into the next slide here. So the status, like I said, was closed. I didn't highlight this one because I guess I must have been in a foul mood or something. But if you look down at the bottom there, you're going to see the violation items. And again, remember last time we mentioned that 1910, 1030, G024. That's that training again. So that was hit to the tune initially of almost $4,500. And it looks like they got it reduced to about $3,000. So that may play on the inspector's day or that sort of thing, but maybe they had something prepared in advance for that visit. I'm not entirely sure, but we'll read between the lines like we did last time to kind of get a look at it and see what we see. Again, I love the small font, and I apologize for that. The first one, that violation we were talking about, annual training for all employees shall be provided within 1 year of the previous training. So again, annual training, my friends, is not optional. It's got to be completed without exception, and it should be documented, documented, documented. You see, I should have been saying that 3 times in a row the whole time. Then I know for sure you'd have it in your head later on. The next item on here, FO24, this was a zero charge. As you can see, the employer shall assure that employees who decline to accept hepatitis B vaccination are offered by the employer sign the statement in Appendix A. This is declination forms. Remember, we were talking earlier about the Hep B vaccination and everything needs to be documented. It's kind of a CYA item, but you've got to be sure that you've offered it and that whether folks decide they want you to offer, whether they decide they have already had it, they want to get it, they say, I'm putting that in my body. Either way, you need to have it documented. And again, I'd be happy to chat with anyone afterwards if you have additional questions, because there are some little hot button topics that crop up when we talk about that. But anyhow, this practice was assessed almost $4,500 worth of fines. And I'm assuming maybe they had some of this paperwork, but they just couldn't provide it at first. And that's why the fine was reduced. But again, if you don't put yourself in that situation, you don't have to worry about this kind of nonsense. All right, so, like I was saying earlier, since 2015, OSHA's bloodborne pathogen standard been the most cited standard, bar none. And there's really nothing that's showing that that's going to change. Even during the heart of the pandemic, nothing came close. And I'm talking about respirator protection in the industry, N95 mask usage. Even during that whole I'm gonna say fiasco, it didn't even come close to bloodborne pathogens. And that's just the lay of the land, I'm afraid. But if we follow these simple rules that we kind of outlined earlier, there's no reason to get zapped with one of these, but for some reason people still do. So I'm hoping that y'all gained a little familiarity with the standard today, and what the small portion of exposure control can mean to the practice in the long run. It's very important. I strongly encourage everyone who's attended the webinar today, when you wrap up your lunch or when we wrap up this call, maybe take a look in those cabinets, see where your OSHA binder is. Everyone should know where it is and what's in it. Make sure it's up to date. Right? Make sure we have documentation of training somewhere. Make sure we've offered the Hep B vaccination to team members. Get in touch with your reps, see if they have any work practice controls or something that, you might be able to implement in the practice. You at the very least get some samples. I mean, it really doesn't take too much to find yourself on the wrong side of one of these things. So I just hope that this helps a little bit. And I want to make sure too that y'all have my information here in case you should have some questions or case anything does crop up. I just want to make sure that you've got someone out there who can maybe chat with you and help you out a little bit. I really appreciate your time and I'd like to open up the floor to some questions here. If anyone has entered anything into the chat. Josh, do we have anything?
I've got a couple questions here. One was, what is the result of repeat violations?
Yeah, those can turn into a willful violation, and it's not uncommon for the fine to jump up 9, 10 times the original amount. Also, and I'll have to find you some examples of this. You can feel free to email me so I have some your additional contact. But they have closed practices down for a short period of time to correct the issues. I'm not aware of anyone being shut down permanently, but I mean, don't quote me on that. That's a possibility too.
Yeah,
So the the best thing is if you get some kind of violation, rectify that yesterday.
yep, exactly. I think I saw that it's an automatic 10x increase. So if it was 4,000, expect 40,000 next time.
Yeah, don't play that game.
Yeah. So there's another question. What should be in the OSHA binder?
Yes, the OSHA binder should have your written safety programs in there. That's going to be exposure control plan, hazard communication, respiratory protection nowadays as well, emergency evacuation plans, maps. You really need to have your I's dotted and T's crossed on that. You should be able to find resources out there that will help you develop everything in there. And there are quite a few requirements. I'd be happy to email exactly what belongs in there and what you should be doing. I should mention too, a job hazard assessment will certainly need to be in there so we can determine exposure risk in the practice.
Yep. Thank you. Another question is, any advice for better solution to SDS? Is there a good digital solution out there?
Oh my goodness. You know, I'll tell you, this is a biggie. You can keep an electronic SDS binder now, but there are some caveats that go along with that. I know we all have those 10-pound binders up in the closet or wherever in the practice, two, three of them. We really need to make sure that we have everything that is in the practice that's deemed hazardous in either an SDS binder or an electronic folder. You don't have to have both. One or the other is fine. And it does need to have an index. A great solution to this, to be entirely honest with you, is contacting your supply company. If you order online, it's quite simple. Look at your purchase history for the last, however long, and you can see exactly what you've purchased and download those SDS sheets. That's usually the best way to do that. I know there are some organizations that will sell you a complete SDS file, I'm just going to call it, of every single product they offer. That doesn't so much meet these requirements because you probably don't have that everything they offer in your practice. So you're just really filling that with things you don't need, things you don't have. And should you have an incident, you're going to have to filter through and search through all that to find what you need. So at the end of the day, it's all about taking care of the team. If someone gets something in their eye, someone gets something, anything, so that's crucial. And I'd also extend one other thing too. Um, your team should be aware of the items that they're using on a regular basis. And when I say regular basis, maybe grab the first 5 or 10 items that they come into contact regularly every day and know what the exposure risk is for those items and know how to apply first aid. That's very important.
Yeah. Now, follow up on that. What's your advice on how often to go through and clear out your SDS binder if it's a printed copy or digital copy?
I love that. I can tell you when I was in OSHA lead in my practices, I would go through that at least quarterly. But I can tell you on Fridays, because I'm a bit of a nerd, I might have sat there with coffee and kind of flipped through it. So that
Very
was the
good.
first half. Was there a second half to that question? I apologize.
Well, just there was is there a digital solution? And then there was another question that went back to the OSHA binder. Can you send a short form list of the contents of the OSHA binder?
I would be happy to. I would be happy to. Please just get your email information or give me a call or send me an email and I'll happily get that information over to you because there are some forms and different things too that should be in there.
Okay. Another question that we have is a practice responsible for providing OSHA training for temporary workers?
That's a very good question. This comes up from time to time. Your temporary workers and when you bring them on, it's a dual responsibility. Everything's shared between the temp company or agency and your practice. So if they haven't provided the training, you're going to need to provide that training. The same goes for Hep B vaccination too.
Very
And
good.
actually, I should mention too, I have a document for that. It's an OSHA letter that I'd be more than happy to if you get feel free to email me and I will send that to you as an attachment. Some great information out there.
Awesome. Another question, does practice insurance cover OSHA violations?
No, no, not that I'm aware of. I no, I don't believe so.
Okay. Uh, and are there any other questions from the group about anything covered today or just in general? Any OSHA questions that you have floating around?
Now, I should mention too, please, I know sometimes we get OSHA can be this big nebulous thing where there's just so much information out there and we're not exactly sure what rules are like, is this an OSHA rule? Is this CDC? Is this like AD? What is this? Where's this coming from? Please, if you have those kind of questions, and I'm sure you may, feel free to email me. I am happy to provide information. I am happy to, set aside a little time to chat and see if we can't, solve these issues. Because the main thing at the end of the day, everyone wants to go home safe to their loved ones, to their family, to their friends, and just not have to stress about this kind of stuff. So if we head it all off at the pass by answering a couple simple questions, or even questions you're just, not sure about, feel free to ask. We're here. We're a resource.
Yep, absolutely. Well, David, I think that is all. If there's no other questions, for everybody that's been in attendance, we really appreciate your time and attention. If you found this valuable, we ask that you direct people our way. We will be posting this up on our YouTube channel. We'll also be sending a link out to everybody. And again, if there's any questions that you do come up with later, please reach out. We're here to help. So thank you, everybody, for your time, and we'll look forward to having you join us next time. Bye.
Take care, everyone. Have a safe week. Bye-bye.